Using eye drops is easy if done the right way. Correct use of eye drops will help your eyes heal well. This video shows you how to get it right each time. You may practice this technique using artificial teardrops before you start your prescription eye drops. Check the storage instructions for your eye drops. Some drops need to be refrigerated. Check the instructions for the proper dosage as prescribed by your eye doctor. Check that the eye drops are not expired. Some drops are suspensions. These drops must be shaken before each use. Otherwise, the medicine will not reach your eye. First, wash your hands with soap and water and dry them. Place a clean tissue on your table. This is a clean place to rest your bottle and cap, as it is important to avoid any contamination with germs. Sit down in front of a magnified cosmetic mirror. There are stand mirrors which you can position on the table. If you have poor vision, try a mirror which is illuminated. This may help you see better. This allows you to watch yourself while you instill the drops and allows you to rest your arms on the table, stabilizing your hands. Open the bottle and place the cap on the clean tissue. Turn the bottle upside down. You may need to tap it or shake it to make sure there are no air bubbles at the tip. Gently pull down your lower eyelid to expose the inside pocket of your eyelid. Angle the bottle tip into the pocket in your lower lid while you watch yourself. Even if your hand does shake, the bottle tip will not hurt your cornea, which is the sensitive part of the front of your eye. Avoid touching the bottle tip to your lid, lashes, or eyeball. The bottle tip needs to be kept clean and free of germs. Squeeze the bottle to watch one drop fall into the lid. Close the bottle cap and set aside. Do not rinse or wash the bottle cap with tap water. Close your eyelid gently for 2 minutes after each drop. You may also try the method called punctal occlusion. Gently press the inner corner of your eye. This helps to prevent the drop draining away from your eye into your nose before it is absorbed by your eye. This allows your eye to get the full dose. It also prevents side effects in your body which may happen if a lot of the drop gets absorbed into your bloodstream from your nose. Some eye drops may produce an odd taste in your mouth, and performing punctal occlusion may prevent this sensation. If you have excess liquid, use a clean paper tissue to block the excess. It is not necessary to roll your eyeball around. It is not necessary to use more than one drop at a time. Using more drops will only cause them to flow down your cheek. Another way to position yourself for eye drops. Lean back with your head tilted up. Pull the lower lid down with one hand. Take the bottle hand and rest it on top of the other hand for stability. Angle the bottle tip into your lower eyelid pocket and squeeze a drop in. Sometimes you just need to have someone else help you with your drops, at least in the beginning, until you get better with practice. If you find it very hard to keep your hands from shaking, there are some devices which your doctor may recommend for you. These devices can be used to hold the bottle a safe distance from your eye while you squeeze a drop in. Ask your doctor if you feel you would like to try a bottle holding device. Some drops come in single-dose vials like this. These vials are designed for a single use. There is no preservative in these drops, so once opened, it is easy to get contaminated with bacteria. With care, you can get many drops out of each vial. Always check with your eye doctor to see if this is safe to do for your eye condition. If you plan to use multiple drops from a vial, you may recap the vial like this. Then, store it in a clean Ziploc bag. Make sure to wash your hands every time you handle the Ziploc bag or vial. Store the Ziploc bag in the refrigerator until it is time for your next drop. It is preferable to discard the bag and vial every day. If you wear contact lenses and need to use eye drops, generally the contact lenses are to be removed before you use eye drops. Most chemicals will stick to the contact lenses and may irritate your eye. Check with your eye doctor if your drops are safe to use with contact lenses. Some artificial teardrops are safe to use with contact lenses. If you are using multiple drops, please wait 5 minutes between the drops. If you rush your drops, they will not have time to get absorbed. Your effort and money will just run down your cheek. If you miss a drop, please use another one and make sure the dose gets into your eye. If you are also using eye ointments, always use the eye drops first. Then wait 10 minutes and use the eye ointment. Finally, be patient with yourself. With practice, everyone gets better.